Right now at 8, we're talking about a bill expanding infertility coverage past this legislative session. Current law limits coverage to people who are presumably healthy and unable to conceive a child or sustain a successful pregnancy during a one-year period. This bill removes the presumably healthy limitation, extending coverage to more patients. So, for example, cancer patients wouldn't need to pay out of pocket to preserve their fertility before undergoing chemotherapy. Both the House and the Senate unanimously approved the bill. So we're talking about what this means. We're talking about what this means for people wanting to start or grow a family. Joining us now to talk more about this bill are Melissa Thompson, a patient advocate, along with Dr. Joshua Hurwitz, a board-certified specialist at Reproductive Medicine Associates in Connecticut. Thank you both for being with us. Melissa, I want to start with you. This bill was very personal for you. Share with us a little bit more as to how deeply personal it was.
So a year and a half ago, I had my first baby, and amidst all the joy of having a baby, I was diagnosed with stage 3 breast cancer weeks after having my daughter. And going through my treatment options, I learned that the chemotherapy I needed would also cause infertility. And if I wanted to if my future included more children, I had to undergo fertility preservation. But that came at a $12,000 cost that I ultimately had to put on a credit card. And so I thought to myself, when patients are diagnosed, should they face these exorbitant costs or foreclose their future of a family? And
right. I mean, you're forced to ask so many questions. Can we afford this? Maybe down the road, but now? And then, a lot of people are forced to question what is more important. Is it my health now or my family's future down the road? It's really difficult, and I can't imagine what you've gone through.
And many patients compromise their treatment. They accept less toxic chemotherapies in order to preserve their fertility. So should patients are they mutually exclusive? Do you have to be, in order to be a survivor, do you have to give up your future?
Right. It's a choice that people shouldn't have to make.
That's how I felt. I felt it was just, we shouldn't put people in that position, because more and more people are surviving cancer, which is great, but look at quality of life after you're a survivor.
Right.
And we want to make sure people live full and happy lives.
Doctor, what does this mean for your patients? What are you hearing from them?
Well, it's a great bill, and we're thankful that it passed. What I will say is that there's a psychological double blow for patients who are unfortunately diagnosed with cancer. First, they hear this devastating news that they have a life-threatening disease. And then for the 10% of patients with cancer in reproductive age years, they end up saying that, wow, now I might not be able to build a family afterwards. So the message I like to get out, and Melissa's doing the most wonderful job in the world, is the fact that you don't have to choose. No patient should have to choose between his or her cancer treatments or being able to preserve their future fertility. And the other message to get out, it's very important to hear that fertility preservation options for men and women with cancer are both safe, easy, they don't delay your cancer treatments, and they're very effective, and they don't affect the timetable when we work with the medical oncologists as well.
Right, a lot of people, when they think about infertility, they think about it as a woman's problem, but this affects men as well. And
Absolutely.
Just talk briefly a little bit more about that, because it might not be something that people initially think about.
Sure. So life-saving cancer treatments such as chemotherapy and radiation and even some surgeries can really harm and damage sperm-producing cells in men and the eggs in the ovaries of women. And there are really easy, safe, effective ways to preserve both sperm and eggs for men and women with cancer.
All right, Dr. Wilson, thank you so much for being with us. We do appreciate your insight. And certainly, as you said, it is great news. We're checking in on the roads now with Rachel Lutz. Rachel, what's going on?
All right, Erica, it's been a pretty busy morning, and we're continuing to deal with a couple of